Hi, everyone. Language is so powerful across the board but that really gets magnified when we're supporting somebody who's grieving a death. I'm very careful when I'm talking to people who've had a suicide death in their life to be conscious about what language I'm using. I never referred to committed suicide or completed suicide. The language of commit can be incredibly stigmatizing. Instead, what I use is died by suicide or died from suicide. So it's very interchangeable with died from cancer, died from a car accident, died from suicide. Also, when I'm supporting someone who's had someone die from a substance related death, I really check in with them around what language they use. I think of a number of people I worked with who actually taught me and said, Andrea, you're referring to overdose, but my person didn't actually take too much of the substance. There was another substance in the substance that they knew that they were taking, right? And there's also something in there that they didn't know that they were taking, whether it was fentanyl, some other opioid. And so it was actually a poisoning, not an overdose. And that's where I find it's really helpful to check in with whatever language we're using with the person we're supporting, just to make sure that resonates for them. But certainly across the board, when I talk about suicide, I avoid that language of complete commit suicide and stick to died by, died from suicide, unless the person who's grieving asks me to do otherwise. I hope this is useful.